Good afternoon, everyone. And today's topic is quinolones, folic acid antagonists, and urinary tract antiseptics. So the most useful drugs of that are quinolones or fluoroquinolones that are antiseptics, and the fluoroquinolones include the ciprofloxacin, levofloxacin, and also moxifloxacin are mm, the widest spectrum antibiotic, and nalidixic acid is a predecessor of the fluoroquinolones, so and is nowadays is used as antiseptics because of the uh, limited uh, because of the resistance and broader acting the wide spectrum antibiotics include the ciprofloxacin, levofloxacin, and moxifloxacin. And uh, and more modern fluoroquinolones are more effective, has less resistance. For example, they don't have a methicillin resistance, and uh, the uh, the mechanism of action of uh, fluoroquinolones includes the inhibition of DNA gyrase, that is bacterial topoisomerase 2, and also inhibition of bacterial topoisomerase 4. That results in the uh, uh, disruption in the DNA synthesis and also in the uh, inhibition of chromosomal stabilization during the cell division. And uh, because the gram-negative organisms are more significantly depend on the DNA gyrase than or rather than gram-positive microorganisms, so the agents have higher affinity for the topoisomerase 4, and that is why some drugs that are uh, should not be used for the treatment of the Streptococcus pneumoniae uh, and for the Pseudomonas aeruginosa infection. Uh, and the spectrum of antibiotic action of fluoroquinolones includes the mostly gram-negative microorganisms, but also Streptococcus pneumoniae. And Streptococcus pneumoniae is uh, mostly treated with the levofloxacin and moxifloxacin, because ciprofloxacin is not a drug of choice anymore because of the uh, weak activity against this particular microorganism, and the levofloxacin is most commonly used because it's specially developed for the treatment of the pneumonia that is cannot be treated with the amoxicillin and other beta-lactam antibiotics. Moxifloxacin can also be used, but is more expensive and the broadest spectrum of action. Then Bacillus anthracis, that is anthrax, can be treated with the ciprofloxacin, and usually the drug is used for the post-exposure prophylaxis of the anthrax. And mostly fluoroquinolones are used for the treatment of gram-negative diseases, and that includes the uh, pneumonia uh, caused by the Haemophilus influenza and Klebsiella pneumonia and Legionella pneumophila. So Klebsiella are all the resistance ones for the and also urinary tract infections caused by Escherichia coli and Proteus mirabilis and GI infections caused by the uh, Enterobacter species and Escherichia coli sometimes, though Escherichia coli is a normal microflora of the GI. And some anaerobic infections can be treated with the moxifloxacin and are sometimes used in the combination treatment for the tuberculosis. So these are the antibiotic spectrum of the fluoroquinolones, and the pharmacokinetics is can be given orally. So almost all antibiotics can be given orally or intravenously. Norfloxacin and ofloxacin are only available orally, and all of them are eliminated by urine. Uh, so norfloxacin has low bioavailability and a short half-life, and that's why is only used for the treatment of the urinary tract infections and also the diarrhea. Ciprofloxacin is effective for the gram-negative bacilli, uh, that is against the Pseudomonas aeruginosa, and can be prescribed orally or intravenously, and commonly used for the traveler's diarrhea caused by Escherichia coli, and also for the Salmonella disease, and that is usually because of the food contamination. And ciprofloxacin can be also treated for the used for the treatment of tuberculosis, and the levofloxacin is the more effective drug that because it can treat the pneumonia, and also can be used for the skin infections, and is active against Streptococcus pneumonia and has high bioavailability and can be given once daily. Moxifloxacin has enhanced of activity against gram-positive, including the Streptococcus pneumonia, and also can be used for the treatment of the anaerobes, including the Bacteroides fragilis. However, it's not recommended for the treatment of the urinary tract infections because it's not concentrated in the urine. Then the ciprofloxacin should not be taken with milk or yogurt because this food will decrease the plasma concentration, so should be only given with the water if given orally, because the calcium that is in the milk and yogurt will prevent the absorption and to increase the bioavailability. uh, the uh, uh, the drugs should not be used with the sucralfate, aluminum, or magnesium containing antacids. Also, two valent cations like calcium and zinc can reduce absorption. Uh, then the uh, adverse effects include diarrhea, nausea, headache, dizziness, and tender rupture. So the uh, tender rupture is because of the articular cartilage erosion. Usually seen in children. So that is why fluoroquinolones should be avoided in pregnancy and lactation and in children under 18 years old. Uh, then moxifloxacin can prolong QT and interval that and predispose to the torsade de Ponte, especially when combined with other medications that prolong QT interval, so they lead to the arrhythmia. Uh, Phototoxicity can also be seen, that is why patients should avoid exposure to sunlight. In case of the phototoxicity, discontinuation is required. Uh, so most common adverse effect is nausea and vomiting, and also diarrhea. Diarrhea is usually after discontinuation. The drugs will interfere with the theophylline, warfarin, and cyclosporine that will increase the concentration because of the inhibition of the liver enzymes by ciprofloxacin, for example, and that is why doses of these drugs should be reduced. So the next group is the folate antagonists, and this includes sulfonylamides and trimethoprim. And microorganisms, unlike the humans, cannot uh, cannot absorb the folic acid from outside, so the cell wall is impermeable for the uh, folic acid, and that is why they have to produce folic acid from the paraaminobenzoic acid. So, and the sulfamethoxazole and other sulfonamides will block the dehydroteorized synthase that is producing the hydrofolic acid, that is a precursor for the tetrahydrofolic acid, that is an active form of the folic acid. And trimethoprim is another inhibitor of the hydrofolate reductase, so the second enzyme required to produce tetrahydrofolic acid, and tetrahydrofolic acid is used for the synthesis of amino acids, purine synthesis, and thymidine synthesis, and all this is blocked by the sulfonamides. And the sulfonamides can be given orally, intravenously, applied topically, and are eliminated by the urine. Adverse effects include crystalluria. This adverse effect can be diminished by administration of uh, uh, basic uh, basic water, like the uh, mineral water, And then hypersensitivity in some patients can be seen, hemolytic anemia, and increase in bilirubin level can be seen in some patients. Then hemolytic anemia usually seen in patients with the glucose 6-phosphate dehydrogenase deficiency, and also thrombocytopenia and granulocytopenia can occur. Can lead to the aplastic anemia. These drugs can also increase anticoagulant effect of warfarin because of the displacement from the binding with the proteins, and contraindicated for the newborns and infants less than 2 months of age, and also for the pregnant women, and should not be given for patients receiving methenamine, since they can crystallize in the presence of formaldehyde produced by the methenamine. So methenamine is an antiseptic. Urinary tract antiseptic. So trimethoprim is an inhibitor of the bacterial dehydrofolate reductase. So that is the second step. So, and when combined with the sulfonamides, it is increases the efficiency of the sulfonamide. So, for example, trimethoprim alone is has this effect, so on bacteria growth. Then sulfur methoxazole alone has the same effect, but when they are combined together, the effect is increased dramatically, and that is why cotrimoxazole is a very effective drug for the inhibition of bacterial growth, and that is why only in combination it is used now, only in combination. So the antibacterial spectrum, so this is antibacterial spectrum of combination of sulfamethoxazole and trimethoprim, that is a cotrimoxazole. So first is gram-positive Staphylococcus aureus, including the community-acquired methicillin-resistant Staphylococcus aureus, that is usually skin infections. The pneumococcal infections will be resistant, so those that acquired in hospital. Then Listeria monocytogenes is the septicemia and leads to the meningitis, can be treated with cotrimoxazole. Then respiratory infections caused by Haemophilus influenza and Legionella pneumophila can be treated with cotrimoxazole in children. Prostate and urinary tract infections also, because trimethoprim concentrates in prostatic fluid and vaginal fluid, that is why it's very effective. But also chronic urinary tract infections can be treated with the cotrimoxazole. Then GI infections by Escherichia coli and Salmonella typhi and Shigella species can be also by Proteus mirabilis can be treated with the cotrimoxazole as well, and can be treated for the carriers of Salmonella typhi. And HIV infected patients usually die from the disease caused by pneumocystis jirovecii pneumonia, special type of pneumonia that is only seen in AIDS patients, so in patients with HIV, and most effective treatment is cotrimoxazole, used prophylactically for all HIV patients with the CD4 plus fewer than 200 cells per milliliter. So these are CD4 plus are immunocompetent cells. Decrease in this number of the cells will lead to the shows the decrease in the immunity of the patient. So the drug is administered orally or intravenously. Mineral water is recommended to drink with the oral administration to reduce the crystalluria, and it is eliminated by the urine. Adverse effects include skin rash when used topically, nausea, hematologic toxicities including hemogloblastic anemia, and also the leukopenia, thrombocytopenia, and these adverse reactions can be reversed by the administration of folic acid, and because folic acid is required for the patient, but it's not permeable for the cells of the microorganisms. That is why can be administered during the treatment. And hemolytic anemia can be seen in patients with the glucose 6-phosphate dehydrogenase deficiency, and immunocompromised patients with pneumocystis generative and can show the fever, rashes, and diarrhea. Increased breathing time may be seen in patients with warfarin combination. That is why monitoring is recommended. And the plasma half-life of some drugs like phenytoin may be increased, because phenytoin is an anticonvulsant drug, and methotrexate levels can increase as well. And the last group is urinary tract antiseptics. These are mostly used to prevent urinary tract infections in women of childbearing age and elderly patients. And usually Escherichia coli is causing the infection if it's uncomplicated. And sometimes cotrimoxazole can be used. And the two drugs are available. Methenamine. So methenamine is antiseptic that decomposes to the formaldehyde in the acidic pH of the urine. And this formaldehyde will kill bacteria. Formaldehyde itself is a toxic. We cannot administer formaldehyde the patient, but we can administer the methenamine. And there is no resistance to the formaldehyde, and that is why it's very effective. And the urine should be acidic for this reaction. That is why the pH of the urine should be maintained, and the sodium bicarbonate should be avoided, including the Coca-Cola and other gas, water with the gas, because gas is sodium bicarbonate. Then methenamine is administered orally, and ammonia is also produced in the bladder. So as you can see from this reaction, water as well. Water is not a problem. Ammonia ammonia is metabolized to the urea. That is why some patients with the hepatic insufficiency, this ammonia can accumulate, so this is contraindication. So side effects include the GI disturbances, and hematuria can be seen. Contraindicated in the renal insufficiency, and should not be used together with the sulfonamides, and because it increases the risk of crystalluria, and they can antagonize each other. So this is all for today, and thank you for your attention. If you have any questions or comment, feel free to ask them below.